Welcome to the webinar.
Thank you.
Yeah, doctor will be speaking on the efficacy and safety of microneedling combined with tacrolimus versus tacrolimus monotherapy for vitiligo treatment, a systematic review and meta-analysis. She is from King Saud bin Abdulaziz University of Health Sciences, Saudi Arabia. Doctor, floor is yours. We are eagerly waiting to hear you.
Is the slides clear?
Yes, doctor.
Okay. Hello, everyone. This is Hadeel Maaddawi, a senior medical student from King Saud bin Abdulaziz University for Health Sciences, Saudi Arabia. First, I want to thank you all for having me here today. It's such a great opportunity to share knowledge and experience about dermatology. And today, I'm very pleased to present for you our study under the title of the efficacy and safety of microneedling combined with tacrolimus versus tacrolimus monotherapy for vitiligo treatment, a systematic review and meta-analysis. Okay. I'm not sure how to move the slides. Okay. So, to start with, vitiligo is a common autoimmune disfiguring skin disease with an estimated prevalence from 0.5 to 2% in both adult and pediatric population. And vitiligo appear to be difficult to treat, as you know, and satisfactory outcome are challenging to achieve. Over the years, various treatment modalities were introduced to treat vitiligo, including topical corticosteroid, topical immunomodulators, phototherapy, surgery, and combined therapies. Tacrolimus is one of the topical immunomodulators that has been successfully used to treat localized and stable vitiligo. And it's interesting to say that recent studies suggested that combining tacrolimus with microneedling can actually increase its efficacy. So first, let's recap how does tacrolimus work on vitiligo. So the mechanism of action for tacrolimus depend on its T-cell specific drug will bind to the FK binding protein to form a complex, and this complex will halt the calcineurin mediated phosphorylation of the transcription factor, which is the nuclear factor of activated T cell. This will result in inhibiting the expression of inflammatory. So this will result in inhibiting the expression of the inflammatory T cells cytokines. So, on the other hand, microneedling work by causing microinflammation in the epidermis or the stratum corneum in specific, which will stimulate growth factor release, including platelet-derived growth factor, transforming growth factor, alpha and beta, fibroblast growth factor, and more. This growth factor will enhance new collagen secretion as well as will stimulate melanocyte migration, and the repigmentation will happen. Other hypotheses also suggested that microneedling also work by causing melanocytic autoinoculation, as the mechanical trauma will stimulate melanocyte migration from the surrounding pigmented areas. So, finally, the efficacy of the microneedling combined with tacrolimus could be a result of the inflammatory response produced that will create a multicellular infiltrate, which in turn can overrule the activity of the melanocyte toxic T cells, and moreover, this immunomodulation will allow the settlement of the migrating melanocytes. So here are the study aims. So this systematic review aimed to examine the efficacy and safety of this combination of microneedling with tacrolimus for vitiligo treatment, and this is considered to be the first systematic review and meta-analysis of randomized controlled trials, including subjective as well as objective assessment. For the methodology, here are the eligibility criteria. So we included patients from all age group with established diagnosis of vitiligo. For the intervention is receiving microneedling combined with tacrolimus. For the comparison group is receiving tacrolimus monotherapy. For the outcomes, we have 4 main outcomes that we will discuss later. And for the study design, we included only randomized controlled trials. On the other hand, participants who received any additional therapies such as topical or systemic corticosteroid or phototherapy, microdermabrasion, they were excluded. The study was done based on pre-specified protocol following the PRISMA guideline, and here you can see the Prospero ID. For the search strategy, an extensive search was done through several databases such as Midline, Embase, Central, also manually through searching the reference list of the included RCTs. The last systemic search was done in mid of November 2022 with no restriction to any data or language. And the process of study selection and data extraction have been carried individually as well as in pairs by the team members. And if in case there was any disagreement, they were settled by discussion or by consulting the supervising author. For the statistical analysis, the random effect model was adopted, and a 95 confidence interval with a p-value that is less than 0.05 was considered significant. For the heterogeneity, it was assessed using I-square and p-value of chi-square, and subgroup analysis was done as well. Moving to the result, so as you can see here with me in this figure, after doing the extensive search through different databases, the search has yielded only 14 RCTs since it's only a novel treatment, and after the screening process, we ended up with 3 RCTs contributed to this systematic review. For the study characteristics, so the total number of the participant is 184, equally divided between the two groups. For the participant age, it ranged from 12 to 16 years. And for the tacrolimus concentration, it was 0.1% in 2 RCTs and 0.03% in 1 RCT. For the needle size, it ranged from half to 2 millimeter. And for the treatment duration, it was carried through 6 months. Here, as you can see from this figure, all 3 RCTs had low risk of bias according to the Cochrane tool for risk of bias assessment. Then we can move to the bulk of this presentation, which is the meta-analysis. So here you can see the first outcome, which is the 5-grade repigmentation scale, or what's called physician global assessment. As you can appreciate with me, the subgroup analysis revealed that applying microneedling combined with tacrolimus showed a significant repigmentation rate in the vitiligo site with an improved rate ranging from 51% to 100% compared to the baseline. We also assessed the repigmentation objectively by the histopathological assessment. So as you can appreciate, the subgroup analysis revealed that treatment with combined tacrolimus and microneedling was statistically and significantly associated with higher, strongly positive stained cells. Then the repigmentation rate was assessed in several body sites such as the face, the trunk, the extremities, and acral areas, and the administration of the combined treatment showed significantly superior repigmentation rate in all assessed body sites compared to the monotherapy. So finally, for the safety, we assessed the adverse event. In general, there was no significant difference between the two groups. However, the subgroup analysis showed that microneedling was significantly associated with painful sensation. However, the pain was only reported to be mild, and this is expected during receiving such a procedure. Here you can see with me the grade criteria for quality assessment. It showed moderate quality of evidence for the outcomes. So, to discuss more, the finding of our review showed that 44.6% of those who received microneedling combined with tacrolimus achieved an excellent repigmentation rate ranging from 75 to 100% on the physician global assessment scale. This is actually inconsistent with previous studies, as other studies showed 4.5, 16, 32%. So, this variation could be attributed to the difference in the dose of the treatment. Also, some trials has recorded the response in only 3 months. However, in the included studies, in our research, the follow-up was up to 6 months. So, previous studies had also investigated the efficacy of microneedling when combined with other modalities other than tacrolimus. So, upon combining microneedling with narrowband ultraviolet B phototherapy, 85% of the patients showed an excellent repigmentation rate on the physician global assessment scale. In addition, there were 2 studies that reported that application of 5-fluorouracil solution after microneedling showed an excellent repigmentation rate on the physician global assessment scale in around 48% of the patient. Moreover, these 2 studies has suggested that microneedling is more effective when combined with 5-fluorouracil compared to the tacrolimus, particularly in the acral areas. So, in addition, finally, there was one study that demonstrated microneedling is also effective when combined with calciprotol, and it is best acted when beta-methazone is added as well. And also, this showed superior result than microneedling combined with tacrolimus. However, the adverse events that are related to the long-term use of corticosteroids should be taken into consideration. So, according to the current number of the trials, our recommendation for the routine use of microneedling combined with tacrolimus to treat vitiligo at clinic is still modest. Therefore, further studies are needed to draw an established conclusion, taking into consideration more outcomes, like, for example, the needed number of the session and the dose with the best response. Here are the strength and limitation for the study. For the strength, this is the first systematic review with the subjective as well as objective assessment, and it has a moderate quality of evidence according to the grade criteria, and it has low risk of bias. For the limitation, there was a limited number of studies with a relatively low sample size, and the follow-up period was not enough to check the stability of the repigmented areas. Usually, it takes 2 years. However, in the included studies, they only had a follow-up about 9 months. So, in conclusion, as vitiligo characterized by its unpredictable course and the difficulty to achieve the remission, this combination of microneedling with tacrolimus could be a very promising modality to improve patients' quality of life. Thank you all for listening. Here are the QR code for the references and my contact, my email, and